distinguished invitees, doctors, healthcare professionals, and media partners and participants. All of you again, Assalamu alaikum warahmatullahi wabarakatuh. Dr. Irshad is my best friend. We grew up together, studied together, same medical faculty. We did the same time with the postgraduate, and I'm in psychiatry and he's in community medicine. And we are working together, alhamdulillah. So it's a long, tedious journey, but we are happily working. And I wish, Dr. Irshad, you will be flying with colors, inshallah, with your puppy initiative. Will make you a big dog, but not a sleeping dog. So, coming to my point, it's actually my thesis also. My submission, dissertation, I did mental health literacy and associated factors. I did it in Columbia University, first year medical students. First year students in almost all the faculties in Columbia University. So we have almost certain areas we are working in common. You have developed a behavioral intervention, so which you are going to apply it, as Madam said, at the grassroots level. So we need some modification. So I am just trying to address that gap. So I am going to talk in psychological aspect when it comes to non-communicable disease. So just to start with, there's a famous, you can watch this in YouTube as well. Walter Mischel, 1960s, or a psychologist professor, he did a very good experiment. Or school corporate Chicago, I believe it's Chicago. School better classroom. And in the classroom, sweets he just advised them, whoever would yaar in the sweet சாப்பிடாம இருக்கிறோ அவங்க 20 minutes extra sweet. So he just closed the door and went, and he was observing through the CCTV. So what he found was very interesting reactions. There's little ones, few students were there closing their eyes, some were asking God, and some people were doing fidgety. But actually, few students, they couldn't resist. At least for 20 minutes, they ate. So what he did was, he followed up them as a prospective study until their high school and university. அப்போ distinct change என்னன்னு கேட்டா, அந்த 20 மினிட்ஸுக்கு கண்ட்ரோல் பண்ணி வச்சுக்கொண்டு நஃப்ஸை கட்டுப்படுத்தி வச்சுக்கொண்டு அந்த group, they achieved much higher in the universities. Their resilience levels were very high. So they did pretty well compared to the people, the students who had the sweet. So that's the simple theory. If you can postpone the gratification, you can postpone the pleasure, your resilience level is high, will rise, and you will perform more. Obviously, our health is going to be beneficial, not to others, to you. So, having said that, we are going to the clinical example. You all doctors, you will see in your clinics, your patient, diabetes, hypertension, patient or a Maulavi or a school teacher, even maybe he's a doctor. He has the knowledge what's going on. He attends the regular clinic visits. But you see, there is no sustained change in his blood sugar. Blood pressure fluctuates, sugar level fluctuates, HbA1c, Dr. Zaki fluctuates. But there's no sustained change. So, have you ever thought, your patient has the knowledge. If recently, Sri Lanka literacy 97.4, it has increased. We have the knowledge, but what is missing? Something is missing. So, what is missing? And that is what I am going to address today. behavior change is driven by your brain, not merely with the knowledge. It's driven by the knowledge. There is a pathway. It comes to the frontal lobe, connecting the amygdala, which actually controls your emotions. We call it as pleasure pathway. So whenever you pass an exam, or even if you take a drug substance, you feel high, you are feeling excited. That's your pleasure principle. Your pleasure pathway works. It releases a lot of dopamine. So you feel excited, you feel happy. So there is the brain is playing a huge part. So it's associated with your amygdala, your emotions play, and your thought, your mind. நீங்க எப்படி அதை திங்க் பண்ற, நீங்க எப்படி அதை பார்க்கறன்றது இட் மேட்டர்ஸ். ஸோ இட்ஸ் நாட் ஜஸ்ட் த நாலேஜ். தட்ஸ் வேர் we fail. Even most of the doctors, even in my clinic, we fail to explore. We fail to ask questions. We just or we scold them or just advise them. முக்கியமான 3 விஷயம். ஒன்று ரிவார்ட் சிஸ்டம், தட் இஸ் ப்ளஷர் பாத்வே. Emotional regulation. We are prone to anger, we are prone to anxiety, that's nature. We are prone to frustration. So how we manage, regulate our emotions, that matters. And our cognition, how can we change our thoughts? Is there a rational argument between my irrational thoughts and the rational? How can I convert from irrationality to rational? So how can we bridge it? That matters. So these 3 areas we have to address apart from the knowledge. இதுதான் மாடல். பிஹேவியர்ன்றது not just the knowledge. It's a combination of reward. Reward in whatever you like. We embark in a job. நான் ஒரு ஜாபுக்கு போறேன். We get the end of the month, we get the salary. That makes us happy. That's the reward. So we are struggling to find job. We feel the Sri Lanka rupees is not enough. So we go to overseas to find dollars because of the excitation, because of rewards. So that's one part. அடுத்து எங்கட emotions. அடுத்த மூணாவது எங்கட thoughts, the way we think, எங்கட cognition. அடுத்தது எங்கட context. டாக்டர் ஜக்கி, மிசாயா மேடம் எல்லாரும் சொன்ன மாதிரி எங்கட லிவிங் கான்டெக்ட். வேர் டு வி லிவ்? அர்பன் ஏரியா, ரூரல் ஏரியா, எங்கட லைஃப் ஸ்டைல், எங்கட கல்ச்சர், எவ்ரி திங் மேட்டர்ஸ். இதெல்லாம் சேர்ந்துதான் எங்கட பிஹேவியர். ஸோ ஒன் பை ஒன் எங்கட ரிவார்ட் சிஸ்டம் என்ன? ஐ எம் ஜஸ்ட் giving examples through your expertise. The first thing is your dopamine pathway that's in your brain. So what we are driven because humans choose immediate reward over long-term benefit. That's what happened in that little ones. The same principle applies to us also. We are focused on immediate rewards, immediate pleasure. எங்களுக்கு அந்த நஃப்ஸை கட்டுப்படுத்தி கொண்டு பின்னுக்கு போஸ்ட்போன் பண்ணி கொள்ளையலாம். லாங் டேர்ம் பெனிஃபிட் we don't worry. We say pay attention to your health in 20s. No one worries. Why should I? I'm a youth. So with the same person 40 years, some changes in glucose, doctor say now he's alerted. You can't postpone, right? That our brain naturally choose the immediate reward. Sugary food gives an immediate pleasure. It's very sweet, tasty. So you eat one piece of cake and your mind asks, let's grab another one because it's tasty, sweet. It gives immediate pleasure. Smoking, tension, stress, workload, office in the வெளியே போற, you can see Marine Drive வெளியே smoking. Because why? Immediately எங்களுக்கு ஒரு relief பண்ணுறாரு. Nicotine is there in our brain. It also associated with a pleasure pathway. It gives sort of a boost, relief, tension குறையுது, right? So we do it. We don't want to stop it. Sedentary lifestyle. சும்மிக்கிற, do nothing. because you get a comfort. You have invested in business. You have monthly income. So you have nothing to do. You have enough money, enough income. Why should I? So do nothing. It gives immediate pleasure, which in the means of by means of comfort, right? So what I should tell you is non-communicable disease behaviors are reinforced daily. Every day it happens, but healthy behaviors are not. Why? Healthy behaviors are long-term benefits. Your NCD behaviors are immediate rewards. So you resort to go behind that. This is one. Other one is, this is a powerful thing you have to remember, the reward mismatch. What happens is, when you embark on unhealthy behaviors, you get the instant reward, as I already விளங்கப்படுத்தின மாதிரி. So healthy behaviors, delayed reward, later. பாவம் செய்யாம இருந்தா மௌத்தான போறதுதான் சொர்க்கம். சிகரெட்டை பிடிச்சா உடனே ரிலீஃப். So I don't mind the haram. I need the immediate thing. This mismatch, the mismatch makes a huge problem, right? What happens is, your brain keeps choosing the wrong option always. The loop changes. You are trapped. So your brain always chooses the wrong option, right? So actually, this is not a lack of willpower. This is the reinforcement of imbalance. These things happens every day. That loop gets reinforced. The brain அதுக்கு தான் adapt ஆகும். So it's not the willpower. Even the உங்களோட பேஷண்ட்டுக்கு மாறணும்ன்ற தேவை இருந்தாலும் he can't change because he is stuck in this loop. If you don't break this loop, he is not going to, the patient is not going to be controlled with whatever diabetes or hypertension or whatever. So that other part is, how do you control your emotional regulations, எங்கட feelings, எங்கட NCD behaviors. ஒரு கொஸ்டின் ஒரு மாசம் அது வந்து இன்னல் இன்சான ஹுலிகா ஹலுகன், அல்லாஹ் தாலா மனுஷனை படைச்சிக்கிற அப்படின்னா உன்னுடைய கஷ்டப்படக்கூடியவனை தான் படைச்சு. That's our nature. So you need treatment, you need counseling, you need psychotherapy, you need support. That's Allah self, he said in the Quran, right? So NCD behaviors are regulated by our emotions. அதுக்கும் பெரிய ஒரு பார்ட்டிக்கு, right? For example, just few examples I am pointing out. Stress ana, some people tend to eat more. பயங்கர ஸ்ட்ரெஸ், ஆஃபீஸ்ல வேலை, கோல்பேட்டி ஆஃபீஸ்ல, ஐடி ஆஃபீஸ், from early morning to evening, on the way to Marine Drive, you stop near the Dynamo, grab a submarine, you eat it and go home. Stress ana, you eat more, right? There are some other people, they go to other extreme, they never eat, they starve themselves. So two extremes, as Dr. Zaki said. Other part, anxiety, பயம், பெர்ஃபார்மன்ஸ் anxiety, நிறைய anxieties இருக்குது. அது உள்ளாக என்ன செய்யற, ஸ்மோக் பண்ற, ஆல்கஹால் அடிக்கிற, so that calms down their anxiety. There are some people, some intellectual people, professionals, they take alcohol before their performance. There are famous musicians, that's why they promote. Famous musicians, stage performers, they resort substances, cannabis, other things, so they can alleviate their anxiety, they can perform in front of the spectators or audience. So they promote, right? So that relieves your anxiety. So we resort to smoke. And you're low mood, you are frustrated, you are depressed. What happens? So what you resort to? Be inactive. ஓட்டை போயிட்டு சும்மா இரு, லீவ் போட்டுட்டு வீக்கெண்ட்ஸ்ல சாட்டர்டே சண்டே யூ டூ நத்திங். நாங்க வெள்ளிக்கிழமை வரங்காட்டி பார்த்து கொண்டிருந்தேன், சாட்டர்டே சண்டே சும்மிக்கிறேன், right? So your inactivity, sedentary lifestyle starts, that's how your low mood. So because of these are the maladaptive coping strategies. Other than sorting the adaptive ones, so we go to the maladaptive pathway. So that also worsens your on a physical condition. അടുത്ത ഞങ്ങളുടെ തോട്ട് ഞങ്ങളുടെ തോട്ട്സ് റൈറ്റ് ഇത് distorted thoughts, irrational thoughts. What are the common ones? What I found in NCD patients, damage is already done. அப்படிதான் சொல்லுவாங்க பேஷண்ட், ஏசி வேலை டாக்டர், ஹார்ட் அட்டாக் வந்து முடிஞ்சு இல்லாட்டி சொல்றேன். ஸோ இது என்ன சொல்றேன், 3 டிப் பாரு, ஃபர்ஸ்ட் டிப் தானே வந்து என்ன 2 டிப் இருக்கிறேன். ஸோ தே ட்ரை டு மினிமைஸ் இட். They don't know the risk. The distorted thinking. I'll start from tomorrow. Severe procrastination. எப்போ கேட்டாலும் அந்த பிசி டாக்டர், இந்த பிசி, மகளோட கல்யாணம், அது வேலை, இந்த அந்த வேலை, இந்த வேலைன்னு I'll start tomorrow. Procrastinate. Daily do the same. Right? I must do it perfectly. Oh, not at all. செஞ்சா 100% superior செய்யும், பர்ஃபெக்டா செய்யும். டயபெட்டிக் கண்ட்ரோல்ல நான் 100% கண்ட்ரோல் ஆகிக்கும், நாங்க அன்னமானம் இல்லை. அப்படி இல்லாட்டி வேலை இல்லை, செஞ்சு வேலை இல்லை, விட்டு போட்டு. all or none thinking, plus and minus, black and white thinking சொல்றது, either in the black or white, not in the gray area. அடுத்து என்ன சொல்றேன், எப்படியோ டாக்டர் என்ன கன்வின்ஸ் பண்ணி ஒருத்தர் எடுத்துட்டார் வலிக்கு, ஒரு ஃபெயிலியர், ஒரு லேப்ஸ். இவர் திங்கிற கேட்டாஸ்ட்ரோஃபைஸ், மேக்னிஃபை பண்ணி, சரி என் டோட்டல் ஃபெயிலி முடிஞ்ச என் லைஃப். ட்ரை பண்ணி பார்த்து ஒரு நாள் ஃபெயிலியர் ஆகி finished. I don't want to do this. Catastrophize. இப்படி இந்த sort of distorted thinking thoughts itself, அதுவும் maintains your behavior. We have to address these stuffs. When you explore with your patients, உங்களுக்கு உங்களோட பேஷன்ஸ், உங்களுக்கு எல்லாரோடையும் உங்களுக்கு டைம் ஸ்பெண்ட் பண்ண எல்லாம் போனாலும் அட்லீஸ்ட் உங்களோட சில பேஷன்ஸ் ஈக்கும், நோட்டி பேஷன்ஸ் ஈக்கும், சென்னதே கேட்கலாம். Try to spend 5 or 10 minutes more and explore them. What's happening? Why can't you stop? ஏதாவது இஷ்யூஸ் இருக்கிறா? So we have to talk about their individual health, individual life. அவங்களோட பர்சனல் லைஃப்ல கொஞ்சம் எக்ஸ்ப்ளோர் பண்ணுங்க. And ask about their family life. What's your wife doing? Your children enna? Recently there might have been some issues. We don't know. That Buddha given us sort of big stress. அவங்களோட சுத்தி ஏதாவது ப்ராப்ளம் இருக்கிறா? ஸோ பர்சனல், ஃபேமிலி அண்ட் அதாவது கொஞ்சம் சரி நீங்க எக்ஸ்ப்ளோர் பண்ணி பாருங்க. ஸோ தே வில் கம் அவுட் வித் லாட் ஆஃப் திங்ஸ். வென் வி அனலைஸ், I usually spend minimum 20 minutes more, sometimes more than 20, minimum 20 with my patient. So I ask everything. எங்க ஸ்கூலுக்கு போனா அது செஞ்சாங்க, வாபஸ் உமா செய்யற. So I gather a lot of information. So I feel gaps. I find out gaps. So rather than எனக்கு olanzapine, fluoxetine, acetylcholine prescribe பண்ணிட்டு போயிடும். In my field, it's not going to work unless I don't address psychosocial issues. The same principle applies to you. If you don't address psychosocial issues, the patient is not going to improve. Right? So, if you put everything together, rewards, emotions, and the cognition together, your patient, you advise for nalaki 20 minutes physical, at least 20 minutes single, 30 minutes physical thing, your patient is not listening. What happened? Immediate reward, because his comfort of சும்மிக்கிறது level, he got a lot of things. சும்மிக்கிறது அவருக்கு நல்லம், எக்ஸசைஸ்க்கு போறதை விட, ஜிம்முக்கு போறதை விட. So he chose that. Emotionally, he wants to avoid the fatigue. ஜிம்முக்கு போனா 20 minutes walk செஞ்சா, jogging செஞ்சா, you heat, fatigue, tired ஆகுது. அதால you feel low, your mood becomes low. So you don't want that. So I choose not to be fatigued. Cognition, I don't have time. Time illa doctor. எப்ப கேட்டாலும் டைம் இல்லை. I don't have time. I don't have time. So you are what happens? இது habit ஆயிட்டு. I don't have time. Right? And context என்ன? Your busy lifestyle. நீங்க எழும்பி புள்ளால early morning 5 மணிக்கு எழும்பணும், புள்ளால ஸ்கூலுக்கு ரெடி ஆகணும், புள்ளால கூட்டின்னு போகணும், ட்ராப் பண்ணணும், then you go to work stress, 4 o'clock, you off. இடையில போயிட்டு புள்ளால பிக் பண்ணி விட்டுட்டு வராது வேற. 4 மணிக்கு when you getting off from the work, your wife or husband calls, bring this, bring that. You have to stop the car, car gills, this and that. When you go home, it's 6 past. You're pretty tired. Busy lifestyle. You don't have time to pay attention to your own health. So if you don't pay attention at least to your physical health, where are you going to pay attention to your mental health? Definitely you don't have time. So this is everything put together. Yeah, what can we do? Just pointing out few practical interventions. How can we modify rewards? So rather than removing, அதை செய்ய வேணும்னு சொல்றதை விட, you try to replace or associate one with another. That's the outcome is better. Rather than say, no, don't. Right? So make healthy behavior immediately rewarding. எங்களுக்கு அந்த கான்செப்ட் யோசிக்கலுமா? Like walk பண்ணுங்க, you listen to music. Associate both. That some of the patients may start that, may be willing to do that. So social exercise. தனியே செய்யாம advise them to go to a group. அதுல சேர்ந்து செய்யறது. ஸோ அதுல ஒரு ஃபண்ட் ஒன்று இருக்கிற சேர்ந்து. அடுத்தது ஸ்மால் வின்ஸ். யூ ஸ்டார்ட் ஃப்ரம் ஸ்மால். நாங்க சின்ன விஷயங்கள் ஒரு நாளுமே வி டோன்ட் அப்ரிஷியேட். எங்கட புள்ளையிலேருந்து என்கிட்ட புள்ள வந்து சொல்றேன், எனக்கு ஸ்கூல்ல இந்த ஒரு என்னமோ ஒரு ஊத்தி ஒன்று விழுந்திருந்த ஐ டுக் இட் அண்ட் புட் இட் இன் த பின். உமா பாப்பா என்ன சொல்றேன், your child is coming with a lot of enthusiasm and expecting appreciation, thinking that my dada, my mama will do this, will appreciate me. You say you are in a busy phone பார்த்து அப்படியா? That's what we do. That's what our response. Because we are so busy in our own world. So appreciate even the small wins. ஒரு நாளைக்கு சரி வரவ நோம்புல உங்களோட பேஷண்ட் வந்து சொல்றேன், டாக்டர் என்ன கஞ்சி குடிச்சோம் இல்லை, ஷார்டேஜ் தின்னோம் இல்லை, ஒரு நாள் அப்ரிஷியேட் இட். குட், வெரி குட், கிளாப். That's how you change. That's how you change. Right? So சூரா 79வது சூறால வாமா மன் காஃப மகாம ரப்பிஹி வனஹன் நஃப்ஸ அனில் ஹவா. நீங்க கிரீடிய போஸ்ட்போன் பண்ணலுமா? தி எண்டிங் போப் யா சொர்க்கம். பேராசைய உங்களோட நஃப்ஸ அதை விட்டு கட்டுப்படுத்தலுமா? சரி, உங்களோட place is where the reward, right? So use that sort of a pattern when you see patients. How can we help them to the adaptive emotional coping? Teach them breathing exercise, anger management, mindfulness. You have mentioned in your research about mindfulness. It's a big topic. We can't talk now. And spiritual training. Dr. Zaki repeatedly emphasized that. Spiritual training. That's part of health. Right? And social contacts. Enhance social contacts. We are living in a metropolitan area where we are mentally, psychologically isolated, although we are living in a community. So mentally isolated. So enhance social contacts with healthy behaviors. How can we challenge cognition? That's our part. psychiatrist, psychologist part. We do CBT, we do psychotherapy, we do counseling. So that's our part. How can we reframe their thought from maladaptive thought to adaptive thought, irrational thought to rational thought? So that's we train them, right? So just for an example, I failed today. Okay, fine. Don't worry. Don't worry about that. We'll start tomorrow. So encourage them. Give them a support. Give them a shoulder to hang. They will feel relieved. They will feel listened. So this how we reframe thoughts. Yeah, that's it. I just wanted to highlight very important thing. These are very, not a one-way communication. This is a two-way communication. Anyway, thank you very much for this opportunity.